Hello everybody, my name is Sylvan Tiencher and I'm a student at ULR in the RN to BSN program. The issue that I want to discuss today has to do with autonomy, beneficence, and non-maleficence in regard to all the patients who undergo um, different surgeries. In our country today, many older adults undergo different type of procedure, whether it's cardiovascular, whether it's um, gastric, whether it's orthopedic, um, and any other type of surgery. Um, what I've come to find out is that sometimes those patients undergo the procedures because they feel like it's going to help. Sometimes they do because of a family that won't let go, and sometimes they also undergo all those procedures because of the physician who always base themselves on the years of experience that they've had, and also because they always think that it's possible to help the person get back on her feet or function to his or her normal potential. A case that I've had to deal with during my few years of practice involved an older lady. She was about 82 or 83 years old, who was admitted with a hip, and she underwent the first procedure, and it didn't quite work well. So she was readmitted in the hospital, and there was a discussion as to whether she should undergo another surgery. The lady was not willing to undergo another surgery, but the son um, wanted her to have the surgery, and the physician was not quite sure whether he should do it or not. Um, I remember going in her room and telling her that it had been decided that she was going to have surgery again on that hip, and her telling me, I really don't want to have any surgery. I just don't see any benefit for me having any surgery. Um, I discussed that with the physician, but I don't remember me being really forceful, being like a patient advocate. And the surgeon, based on what the son had said, went ahead and proceeded with the surgery. The surgery did not go quite well, and she had to be readmitted in ICU. She spent about 10 days in ICU, and as the weeks went by, when I inquired about her, I was told that she finally did not make it. She passed away. Looking back at what had happened, um, I believe that sometimes the principle of autonomy is not always respected when we take some of those old patients to surgery. Had we, in this case, listened to her, um, maybe she would have spent a few more days on this earth without having to undergo what she had to go through. She did not want surgery, and she had let me know, and I'm sure she had let the physician and also her son know, but because she was old and she didn't really have any voice to defend her position, uh, the son took over because I believe he was the power of attorney. Um, I've looked at some research and found out that although many of the procedure that older people in society undergo have helped to increase their living and help them also to live near to full potential, many other surgeries are not really helpful and do not really help of older adults to regain uh, um, uh, full sense of functioning in their environment. Um, in this case, for example, the patient was readmitted in ICU and had to spend 10 extra days on the heavy medication, heavy procedure, just to see if try to save her and try to at least transfer her back to a regular floor where she could be careful. But it didn't happen, and a readmission in ICU carried with it an increased cost and also multiple mortality rates, at least 32%, when it comes to complication in older adult population. My conclusion here is that we should look at our older population and the surgery with not only the sense of what we want to do, but mostly with the sense of respecting their autonomy, with the sense of looking at the benefit. What does the patient wants to do? What would be the benefit of that surgery for the patient, not for the family or for the physician or for the healthcare team? And also, do we always look at the principle of normal efficiency? Do we also look at it as on the by telling ourselves, are we gonna harm her? Who are we gonna harm by deciding to engage in this procedure? Looking back, I believe that what I would have done differently would have been to try to be a little bit more forceful, try to be a patient advocate, and try to let the son discuss the option of the son and then discuss the option fully with the physician before they had decided to carry to go ahead with the procedure, and I didn't do it. And that's something that I think I will have to deal with for the next case that present to me. Thank you very much.